Also joining us from the Russell Rotunda in the Senate Office Building is Democratic Senator Tom Harkin of Iowa. Senator Harkin, good morning to you.
Good morning, Maggie.
I'd like to address right off the bat the criticism that I'm sure you're well aware of senators like you and Senator Nelson who have included provisions in this bill for your state. I know that the argument for this is that's just the way it is. Of course, senators try to get as much as they can for their states. But just because that's the way it is, do you think that makes it right? Can you understand the criticism that you should support or oppose something based on principle and not based on what it can do for you and your state?
Well, the principle of this bill overrides everything. That we're going to increase the number of people who are covered by insurance. We're going to increase affordable care. We're going to crack down on abuses by insurance companies. And the biggest part of this bill that's not being reported very much is we make a huge paradigm shift, is the kind of word I use, towards health care, not sick care. We have more in this bill for prevention and wellness than any bill that's ever passed the Congress. So those are the big items in this bill. That's the big thing. Now, there's a lot of small stuff in this bill that people have put in there, but on almost every case, even the one that's being talked about for Nebraska, it also benefits other states. It's not just Nebraska.
So
and I think that's being lost.
Just so I understand, would you support this bill even if they said to you today, Senator Harkin, we're going to take out those special provisions that we have for Iowa in this bill?
Absolutely.
Okay.
Without a doubt.
So even if this happens and it passes the Senate, then you have to reconcile the differences with the House bill, which contains a more stringent restrictions on abortion and no public option. Would you be willing to change your position on either of those two issues?
Well, I already have. Again, that's the art of compromise. I am a strong supporter of a public option, remain so, and I believe that sometime in the near future we will revisit that issue again and we will adopt a public option. It's not going to probably happen on this bill because we need the votes to get the big things through, Maggie. We have to keep our eye on what we're trying to do here. We're trying to cross a demarcation line. This is the way I put it. On one side is health care as a privilege. On the other side is health care as a right. With these votes, with the vote that we'll take before Christmas, we will cross that line finally and say that health care is a right of all Americans.
All right, Senator Tom Harkin, thank you and Merry Christmas to you.
Merry Christmas, Maggie.
All right, thanks.